So just be your name and organization, please.
Yes, my name is Patricia Del Marmo. I'm the Northern California Area Director for Concerned Women for America. We have 500,000 members nationwide and over 20,000 in California. I do encourage a support vote. Thank you.
Thank you.
My name is John Girardi. I'm a representative of California Family Council and California Family Alliance. I'm a constituent of Mr. Patterson, and we are strongly in support of this bill. We think it gives options for women who are in need. Thank you.
Thank you.
I'm Ralph Merletti, member St. Rose Parish, South Sacramento, and I strongly support this bill.
Thank you.
Dr. Arthur Miracle, pastor of New Hope Baptist Church of Santa Rosa in Sonoma County, very much in support of this legislation.
Thank you.
I am Brian Brackney. I have worked in helping the rights of people with psychiatric disabilities. I know that women with psychiatric disabilities are often pressured into abortions. I know it from firsthand. I support this bill strongly because I think.
Thank you.
I know one woman who was helped by one of those agencies way back in '91.
Just your name and organization you're representing. Thank you.
Linda Kurtz, Yuba City, work with women coming out of human trafficking. I support the bill.
Thank you.
I'm Pastor Steve Andrus in San Pedro, California. I pastor Bayview Baptist Church. I'm with Awake America, and I strongly support this bill.
Thank you.
My name is Pablo Lopez. I'm a chaplain at Rancho Los Amigos National Rehabilitation Center, and I strongly support this bill.
Thank you.
I'm Mrs. Gaynell Gleason, a resident of Roseville, California, and a supporter of this bill along with Women's Friend.
Thank you.
My name is Kathy Nelson from Antelope, California, and I strongly support this bill.
Thank you.
My name is Janet Jacobson from CareNet of Paradise, and I strongly support this bill.
Great, thank you. Anyone in opposition?
Hi, thank you, Chairman and committee members. I'm Rebecca Griffin, the Assistant Director of California Programs for NARAL Pro-Choice California, and I'm here to express our strong opposition to this bill. This legislation would undermine women's health by requiring clinics to direct people to an organization that has a documented record of spreading medical misinformation and deceiving women in the interest of an ideological agenda. This bill requires abortion clinics to share information about crisis pregnancy centers, as was said. These are the facilities run by anti-choice organizations that target women seeking abortion care and use this medical misinformation and manipulation to push them toward one option and one option only, regardless of their circumstances. NARAL did an extensive investigation of CPCs in California last year, and we found that 91% of the sites our investigators visited were falsely linking abortion with medical problems such as breast cancer, infertility, mental health issues, and even death. The particular phone number that is in the proposed notification goes to Option Line, which is run by an umbrella organization for CPCs, Heartbeat International. Recently, a journalist attended the Heartbeat International's training conference, and the director of this very hotline advocated that people share misinformation about birth control on the phone and hide the organization's anti-abortion message. They also recommended avoiding any questions about abortion when people call on the phone. Trainers at the conference recommended having two websites, one for their donors that was clearly anti-abortion, and one for potential clients that hid their agenda and had what appeared to be more neutral medical information. The Reproductive Fact Act, which we sponsored last year and Assembly members Chu and Burke co-authored, has come up a lot in the context of this bill. And opponents of abortion rights are so upset by that bill that they filed 5 separate lawsuits against the state because they do not want to share that neutral information with women about reproductive health services. And this bill is an angry response to that by organizations that have operated with impunity until California became the first state in the country to take a stand and take action. That bill was passed because we recognize the importance of giving information about available reproductive health services to women and recognize some of the barriers to that health care that have been put up by some of these CPCs. This body has a strong record of supporting women's health, and we encourage you to continue that by voting against this bill. Thank you.
Thank you. Yeah.
Good afternoon. Thank you, Mr. Chair and members of the committee. My name is Kathy Kinnear. I'm the president and CEO for Planned Parenthood Affiliates of California. We're the statewide public policy office that supports the 7 local Planned Parenthoods that operate about 115 health centers across the state of California. We have always been committed as a healthcare provider to providing non-judgmental, non-biased information to our patients so that they can make the decision that best is for them. We do not try to direct our patients to make a decision one way or the other, and that's core to what we do. We're firmly committed and support women who elect to continue a pregnancy, and we make sure they have referrals, and in areas where they don't have access to prenatal care, we're opening a health center in Antelope Valley because half of the women there have no prenatal care. So we're committed to supporting women and to referring women to providers in their community who will offer them non-biased support services because that's what they need. They need to be respected and honored, and they don't need to hear information demonizing us or any other provider of reproductive health care. And there have been other bills in this legislature before this body. Senator Mitchell's bill, SB 23, that extended the maximum family grant, which designed specifically to help women who've determined to keep and continue their pregnancies to getting $50 a month for diapers. And that bill was not signed into law by the governor, but we're continuing to work on it because we are committed to the women. So we ask for your no vote. Thank you.
Thank you very much. Others in opposition, please come forward. Just your name and organization, please.
Jessica Stender, Equal Rights Advocates, in opposition.
Brian Ortiz, ACLU of California, in opposition.
Shireen Dada Whitaker, Women's Health Specialist, in opposition.
Zora Whitaker, ESCOT volunteer with Planned Parenthood and Women's Health Specialists, and in opposition.
Geraldine Stapleton, President of California National Organization for Women, in strong opposition to this bill.
Lydia Bourne, representing American Academy of Pediatrics, in opposition.
Thank you.
Kathy Mossberg, on behalf of both California Family Health Council as well as the Public Health Institute, opposed.
Thank you.
Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists for California. We're respectfully opposed and ask for your no vote.
Thank you. To the committee, questions or comments? Ms. Olson?
Thank you, Mr. Chair. To the opposition, a few questions. Either one of you is welcome to answer. Do you believe women, particularly low-income women or women seeking confidentiality who may be pregnant or need other services, deserve free information about services that are provided and in free services themselves as well?
Absolutely, we do. And in fact, we have referral lists that we provide patients for those services in their communities. We're absolutely committed to giving them all of the information.
And did your organization support AB 775 in an effort to provide additional information to women about where they could seek free services?
So I'm not sure what was the bill.
AB 775 was David Chu's bill that required crisis. Okay, thank you. Do you think it's positive that Planned Parenthood, at least according to the witness today, that Planned Parenthood, and I'll use the opposition testimony's own words, gave her one option and one option only when it came to her positive pregnancy test, and that option was contrary to her desires, and when she expressed that, didn't provide her any additional services?
Obviously, this was the first I heard of that, and I will personally go back and ask our local affiliate to look at their referrals and provide that to Assemblyman Gallagher.
Okay.
But it would be unusual and not consistent with what we do.
Are you aware that there are additional witnesses who have shared similar experiences, in fact, nearly identical experiences at various Planned Parenthood affiliates? And when those are identified, is there a conversation with that particular affiliate that they are acting contrary to what you profess is Planned Parenthood's policy?
So I can only speak to this one case that I've heard of now, and I'm happy to follow up on that. And I will follow up on any of these individual cases. As you know, I can't contact those patients, but if they would like to have me follow up and contact me, I will do so. And if our affiliate is not taking appropriate action, we will in fact correct it, because we follow national guidelines for counseling, and we are supposed to be non-biased, give women all of their options, and give women a list of referrals. That's our policy. And if someone's not doing it, then I want to know, because I'm going to stand here and tell you that's our policy and that's what we're doing. And I will follow up.
Great, thank you. Would Planned Parenthood suggest that transparency and providing information about services is a good thing in all circumstances, assuming that information doesn't include opinion comments but is just factual in nature?
If they provided factual information, then that would be completely different. But that is not what's happening in these health centers. And many are not licensed health centers.
I don't believe that was my question. Maybe I didn't state it correctly. AB 775 now requires crisis pregnancy centers to simply post a notice at their facilities that abortion services and other services are available at various clinics in that community. I think you would suggest that's just a very factual statement around where such services could be provided. Is that correct?
Yes, that's a statement that makes sure women understand that they have a right. They will have already been receiving misinformation from that those individuals about abortion and what they can or cannot do, what resources they have. So it's very important that every woman knows she has those options.
With a factual
notice. Not to make the decision, but to give her the information to have the option.
Right. And so this bill, AB 2775, requires a nearly identical notice, but this time in Planned Parenthood clinics or other clinics, simply stating the very factual basis that free services are available to women seeking pregnancy tests or who may need services for pregnancy, et cetera, at X crisis pregnancy clinic, no opinion. So what would justify your opposition to this factual statement when you not only supported but advocated for an almost identical factual statement in crisis pregnancy centers last year?
So here's what's different. When a patient comes to us for pregnancy testing, we do patient history, we do her eligibility to see if she's eligible for the state family planning program, which we're a provider of, and she's eligible to receive family planning services. And under that, as a provider of family pack services, we have to follow their standards. And in their standards, you do counsel women on all of the services that, all of their options if in the event of a positive pregnancy test. We don't try to talk her out of one decision or another. We just try to say, these are all of your options. And then
I understand. I don't think that relates to my question.
Pregnancy, we give them information and referrals for her to follow up on. And in some cases, we actually provide the services ourselves.
Which is fantastic. But I don't believe that was my question. My question was, how does Planned Parenthood justify advocating for the requirement that a very factual notice be posted within crisis pregnancy centers, but now is actually advocating against providing a nearly identical factual notice within Planned Parenthood clinics or other abortion clinics about crisis pregnancy centers?
So the notice
How do you reconcile the two?
The notice itself may be, as you call it, factual, but once they arrive there, that's where the factual part often ends, and that's where the
bill isn't about what happens within the clinics.
Misinformation.
Excuse me. The bill isn't about what happens within the clinics. The bill is about the factual, and we have competing testimonies about what happens within crisis pregnancy center clinics, as well as what happens within Planned Parenthood clinics, both of which are suggesting things contrary to policies are taking place. So the apples to apples comparison is what is required in the notice that's posted within these clinics. And what I'm trying to understand is why Planned Parenthood would advocate for one in one type of clinic and advocate against the exact same notice in another clinic.
This notice is specific to one of potentially many other providers. There's many services and many other referral points. We don't refer patients to an 800 number run by an anti-choice organization. So it is not apples to apples.
So if we amended the notice requirement, would that be something that Planned Parenthood would support?
If the notice requirements said we provide referrals for patients who determined to continue their pregnancies, we would provide referrals to women who continue their pregnancies because that's what we're doing now. They're upset because they may not be on our referral list. That does not mean that we don't provide patients with referral lists.
I don't believe you're answering the question. Well, I'll conclude with you to say that I invite you to spend a day with me in my district at any one of these pregnancy clinics. You can spend an entire day with me, and I think you'll quickly discover that many of the comments in your opposition testimony provided today are simply unfounded. And with that, through the chair, if it's okay, I'd like to invite up the American Academy of Pediatrics to ask a couple questions.
We've actually concluded. They weren't witnesses. We've concluded.
Well, they were
we
witnesses.
have other questions.
They expressed opposition to the bill.
We have other questions to be asked first. So can we have?
Okay, but I think we're during a time where we normally engage in conversation and questions and discussion from the dais. So once that's concluded, I'd have questions for the American Academy of Pediatrics, please.
Other questions, comments, Mr. Chu.
Thank you, Mr. Chair. First, let me start by thanking everyone who's come out to testify, whether it be in support or in opposition on this issue. I think we all very much respect very sincerely held beliefs on this issue. And to the author, as I have said to him in private as we've discussed this, if imitation is the highest form of flattery, I'm very flattered that you went through the effort to model your AB 2775 bill after our AB 775 bill, which was signed by Governor Brown last year, our Reproductive Fact Act. But as you know, I have to respectfully disagree that your bill does anything to provide facts for women seeking reproductive health services in California. So I'd ask my staff to just pull up some notes, our folder about last year's bill, and I found a couple of pamphlets that were distributed at one of the clinics that I know you're supporting. And just to read from this one particular pamphlet, complications from abortions include hepatitis, sterility, infertility, miscarriages, premature delivery, and breast cancer. And there have also been surveys of these clinics whereby 70% of these clinics are telling women and young girls that they have an increased risk of breast cancer due to an abortion. 85% are suggesting there's an increased risk of infertility due to an abortion. 85% are suggesting a mental health problem due to an abortion, and so on and so on. Last year when we heard our bill in committee, we heard from doctors who had treated pregnant women that had been originally cared for in the centers that we're talking about, where complications were missed, and not only diagnosed well into a woman's pregnancy, and we know the challenges that creates. From my perspective, I don't think there is a compelling state interest with this bill. In fact, I think it would do more harm. And on a side note, just to inform our colleagues, after our bill was passed, as you know, it was subjected to a legal war, and there were a number of lawsuits that were brought against it. And I remember as we debated in Judiciary Committee, I had the perspective that this would be constitutional. You did not. In every court in which it has been ruled, our bill is constitutional. And we've also found it disturbing that the litigants who are bringing these lawsuits are trying to cut deals with local counties to not enforce AB 775 in return for dropping them from frivolous lawsuits. And I just don't think that these are blackmail legal tactics that have any place in civil discourse. And with that, I strongly urge our colleagues to vote no on this bill.
Mr. Chairman, could I just address a couple of those issues? So one, I mean, Mr. Chu, you and I both agree that we want to help women in these situations. I know that both of our hearts are in that same place, and we may disagree over, the implementation of that. But I think your motivation and mine with this bill are really very similar. As to the issue of misinformation, I think it's important to address that because, first of all, that was done by a report that only studied 27% of all the crisis pregnancy centers in California, so a very small sampling. Over half of those were unlicensed crisis pregnancy centers. So the sampling there is something I would question. But the other part of that is that That survey was done by people coming into those centers under false pretenses, saying that they were pregnant when they were not, and trying to get information that would undermine those pregnancy centers. Very similar to what happened with David Daleiden and Planned Parenthood, and I think there's many in this room who would say that wasn't an accurate portrayal of what happens in Planned Parenthood. Well, I would submit to you that this report is not an accurate depiction of what happens in these crisis pregnancy centers. And I'm not sure where you got that specific pamphlet from, but what I've seen, and I think what our witnesses have testified to, is that these provide a great resource to women. And what I'm submitting to you is this helps supplement what you've done last year. And even if I assume what you say is true, right, that there's misinformation, where the person would get my notice under 2775 is at the clinic that you say is giving the right information, right? So they're at a clinic where you're saying they're getting the accurate information. So they're already, under your legislation, protected from that standpoint. But then they're getting information about, well, if you decide to carry your pregnancy to term, there's other resources out there that can be very helpful to you. And I think even the testimony I've heard today from Planned Parenthood is they do referrals, and this helps supplement that, saying, hey, if you are going to keep your baby, that there's additional resources out there to help you. And I think nobody would disagree that these crisis pregnancy centers are very good at that. They're very good at that in terms of coming alongside these women, helping them get access to resources, helping them sign up for public assistance, helping them get into work training programs, helping them to lead a productive lifestyle, all of which is beneficial to women as a whole. So that's why I'm saying this legislation covers the whole. As to the constitutionality issue, I think my bill actually helps your bill because there's going to be appeals, and down the road, if this looks like it's targeting one group because of its beliefs and because of how its views, I think you are going to have a constitutionality problem. But you would have a much better constitutional standing if you provide this across the board and we're giving women information about all the resources that are available to them. So I really think this is actually complementary rather than be, antagonistic towards you. I know that that's how it felt, but honestly, I think this actually completes that whole cycle of transparency, like I said.
Ms. Bonilla?
Thank you. I think there's been a lot said that's outside the scope of this actual bill that we're considering, and I understand that and appreciate it, but I want to bring it right back to what we're looking at today in the report. And I guess my trouble with the bill currently is the phone number. The fact that there is this specific, who knows who's on the other end of this phone, and we're just directing people there. I think it's completely irresponsible to have that phone number in there. So my question to you, because I really don't have a problem with the rest of the statement, and I don't think that it's something that would do harm. I think it's actually information that could benefit a lot of women. And as you state, they're already in a clinic where this is just ancillary additional information. And we've already heard that there's resource lists and additional information being given to them. So I really don't see the harm. I think it's consistent. As long as that phone number is removed, as long as it's not a specific referral, I think people are capable of finding these, their resources on their own. So have you considered removing that phone number, and that specific link?
So, yes, I would be open to changing that. I sort of used that number because I knew that was something that was out there that really said, here's all the clinics that are available statewide, right? Now, I'm not tied to that, and that's the whole point of us taking legislation through the process is we can make changes there. I would be open to something that provides women with all the different resources that are available to them, including the crisis pregnancy centers. I don't want to exclude them.
Well, my question
but I would say something that sends them to a place where they can find out all the different
We don't need
resources.
To send them anywhere, in my opinion. I mean, my question to you is, the information is just a notification. Last year we were dealing with a notification. There was no direct referral, no phone number.
Yeah, there was a phone number, actually.
Did you guys have a phone number? Oh, yeah. So they were recommended to a phone number. But I'm not interested in you inserting what? Local county social services, I guess, was the phone number. And I think that's a governmental, agency and something that we know who's on the other end of that line. My question is not, I'm not asking if you would substitute some other, direct contact. I'm wondering if you consider just doing it as a notice.
Well, if there's a notice, but it doesn't really tell you where those things are, how do you access them?
Well, I guess Google would work.
Well, I mean,
all right.
I'd like to see is maybe if we can work through something where there is a website or some sort of resource. For example, you have this, I think, on your desk. This is something that SAC Life Center actually gives out to women. This thing has every single resource that can help. Mm-hmm. I mean, look at this thing. It's like 6 pages long. That talks about places where you can help with housing, where you can help with immigration.
I was trying to help you get there. I don't think I achieved it.
Well, what I'm saying to you is I am open to having something that will provide them, because it's one thing to say, hey, there's resources available, and I think Mr. Chu and Ms. Burke would agree with this, but you still have to provide them something that's going to tell them where those resources are. Otherwise, they won't know how to access them.
Well, I don't agree with you that they wouldn't know how. And like I said, I was trying to get you somewhere. And, if you don't want to go there.
I'm open to amending the bill to take out the number and put something else that would provide information.
That was not my question.
No.
I'm sorry. I was on the phone number a little bit myself, so I called it. No one answers the phone number. So I'm trying to figure out by what method you chose who would answer the phone and what qualifications that person or group would have. My second question is, this young lady seemed perfectly capable to find somebody to help her, and I would like to ask her, and by the way, I am very happy for you. I am glad that you have found a best path that best suits you. I would like to also ask you how you were able to find your solution as well.
Oh, okay.
I don't know how exactly she found the place. I know that she found it.
No, the original question was, how did you determine the number, and how did you decide who was qualified to be on the other end of that number? That's actually the question for you.
My understanding is a working number. I don't know what happened when you specifically called.
I called and I got voicemail. I've called a couple times.
But I know that that's a number that is available that provides information about all the crisis pregnancy resources centers in the state.
Okay.
And I think originally in the bill we had a website, and there was some concern about submitting it to a website, so that's why we did a number, because that was similar to what was done with 775.
And so the qualifications for your decision as to what number and what website was on there was based on licensing, was based on what exactly?
It was based on providing information about where you can locate crisis pregnancy centers anywhere in the state of California.
And if indeed you have called and you've got a busy signal or a voice message, that would be the first time in 12 years that that's happened that I'm aware of, because it's a number that's available at 2 in the morning anywhere across the United States by a zip code-based connection of a woman and the resources she needs. And I find it interesting that there is so much being said about, wanting to be fact-based information when at 53 years old, the industry told me that it was just a clump of cells. And so I find it fairly hypocritical that here we are priding ourselves on being fact-based when so many women my age made a decision to terminate a pregnancy under misinformation provided by the industry that sits at the table here with us. And Shantae can explain how she came across the resources that she's receiving.
I came to the Life Center. I didn't know about any of these resources. I actually met Juanette at a McDonald's and kind of needed help and asked questions, and that's how I found out about the resources. I didn't know. I don't have any way to get the resources.
Thank you. I'd move the bill.
So we have a motion and a second. Any other questions? Seeing none, we'll ask Mr. Gallagher to close.
So I really do appreciate the questions and the discussion, and again, I want to say I'm not married to the exact language of this bill. The whole point of this isn't about pro-life, pro-choice. It really isn't. It's about resources and about making sure that women have access to all of the resources. And so, to me, I would really ask you to consider that, these clinics are really good at what they do in terms of helping women who have decided to keep their baby connect with resources that can help them. And I personally have seen it. It's been documented time and time again that they do. And all I'm saying is Planned Parenthood is one resource, the public clinics are one resource, but these clinics are also a resource. And I think the way this is set up with 775 already being law, and with this as a supplement on top of it, you're providing that transparency. And for those who are concerned about misinformation, though I might personally disagree about that, but for those who are concerned about misinformation, the place where they would get my notice is in the place where you're saying they're getting accurate information. So, like I said, it completes that cycle of information and access to resources. We can talk about how we make sure that those resources are broad. I would just ask you to work with me on that. But ultimately, this legislation does help women when they're in a crisis pregnancy and they need resources and help. Thank you, and I ask for your aye vote.
Thank you very much. So we have a motion and a second, and the motion is due pass to appropriations, and I'll ask the Secretary to call the roll.
Wood?
No.
Wood, no. Mainshine? Bonilla? Bonilla not voting. Burke? No. Burke, no. Campos? No. Campos, no. Chu?
No.
Chu, no. DeBobney? Gomez? No. Gomez, no. Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Olson? Aye. Olson, aye. Patterson?
Aye.
Patterson, aye. Ridley Thomas? Rodriguez? Rodriguez, no. Santiago? Steinnorth? Thurman? Waldron? Aye. Waldron, aye.
The motion, the bill stands at 4-6 with members still missing, so we'll leave the roll open for additional members to vote.
Thank you, Mr. Chairman. In the event that the bill doesn't pass at the end of committee, I would ask reconsideration.
And it would be granted. Thank you.
Thank you.
Let's see. Looking around, how about authors from the dais? Mr. Chu, would you? I'm sorry. I'm sorry. My apologies. My bad. Mr. Allen is here.